Hello, welcome back to the channel. If you're joining us for the first time, please go ahead and hit that subscribe button to stay in the loop on news that matters to South Africans and our region. And stick with me until the end so you can check out the sources for this news and try to verify it yourself. Today we have a deeply troubling situation unfolding across our country. An increasing number of people have joined Operation Dudula, the anti-migrant movement, and their actions have taken a dangerous turn. Reports confirm that migrants are now being completely blocked from accessing at least 53 public clinics across the country. Operation Dudula members have ramped up their campaigns, targeting not just shops and informal businesses but also healthcare facilities. They've set up blockades outside clinics and hospitals, demanding to see identity documents and denying entry to those they suspect are undocumented migrants. According to recent coverage, these blockades are now affecting access to essential health services in at least 53 clinics, leaving many patients, especially vulnerable groups like pregnant women and those with chronic illnesses, desperate and without care. Now let's think about that for a moment. First, imagine you are a migrant, undocumented or otherwise, and you need medical attention for an urgent issue. Maybe it's a child needing medication, maybe it's a prenatal appointment, or someone battling HIV or diabetes. Now the clinic is closed off because vigilante groups are deciding who gets treated and who doesn't. This is more than criminal, it is inhumane. The Constitution is clear that all people who need emergency medical treatment must be seen, regardless of documentation. Healthcare workers pledge their duty to heal first, verify later. This vigilante approach turns health facilities into battle zones, putting more lives at risk, especially of those who already face barriers to healthcare every single day. I spoke to a legal analyst who reminded us that migration in South Africa is not new. It began during the gold rush in the 1800s with people of all backgrounds seeking work and opportunity. To deny them care when they are sick is to strip away both dignity and humanity. As the analyst said, one must treat the person first, then deal with paperwork. Chasing away pregnant women or sick children at clinics is cruel beyond words, and the state should be the one responsible for setting fair and lawful policy, not uninformed mobs. Because migration and access are sensitive topics, it's vital to look at what's being said and done. Operation Dudula defends their actions by arguing undocumented migrants are straining public services that are already overloaded and under-resourced. But scapegoating migrants doesn't fix our challenges, it shifts blame away from the real problems, like poor planning, underfunding, corruption, and failing service delivery systems. Opposition to Operation Dudula has grown, including court battles. Groups like Copenhagen Africa Against Xenophobia and civil society organizations have taken legal action to prevent these groups from blocking access to care, schools, and other basic rights. In fact, as of June 2025, these cases are being heard in court, with the state also part of the process due to its failure to protect vulnerable communities. It is alarming to see more people joining these blockades. Communities report growing tensions, fear, and suspicion, even amongst neighbors. South Africans themselves are divided, some support Dudula's stance, pointing to job scarcity and resource strain, others are horrified, arguing that denying healthcare is not how we solve problems in a democratic society. It also raises personal worries. What about families living in poor communities, who rely on public clinics for routine checkups, vaccinations, medication for chronic illnesses? Women giving birth or mothers with young children being turned away, those images are distressing and deeply shameful for a country trying to heal its wounds. When people block access to clinics, they are shutting off the last buffer against suffering for those who have nowhere else to turn. Of course, none of this is easy to fix overnight. But there are more constructive ways forward. We need improved border management, yes, but also more investment in clinics, quicker hiring of medical professionals, fairer allocation of resources, and clear public messaging that healthcare is a right, not a privilege, and certainly not subject to vigilantism. Now, I know we have spoken of heavy issues, so let's shift just a little and add a bit of lightness. You know, as South Africans, we tend to find humor even when things get grim. Someone joked that Operation Dudula might want to change their name to Operation Dudencare because they clearly don't care about healthcare, just about causing chaos. Another said if they were doctors they'd start patients citating outside their clinics, not patients waiting inside but doctors waiting outside, so these vandals would see who gives care first. It's our way of coping. When tragedy hits, we pause, we laugh, and then we get back to fighting for justice. So South Africans, what are your thoughts? Do you think the government should clamp down harder on these groups, or even legislate that denying healthcare is a criminal offense? Should patients be able to file criminal charges if they are turned away from clinics? Let me read your views in the comments. Let's have a respectful and thoughtful debate, because this issue affects all of us, regardless of our background. Before we close, I want to remind you again, hit that subscribe button if you haven't yet. Sharing this video helps get awareness out too, and we all need to stay informed and stand up for human rights. All images used in this video are for illustration purposes only. News sources for this news include Daily Maverick, Ndaho Media, and Wikipedia.